Hi, I'm your host Habib Alajade, and I'm here interviewing Joe, physical therapist. We're going to be talking about vestibular rehabilitation. Okay, so for our viewership, what really is vertigo?
Well, vertigo is commonly characterized by spinning or a rotation sensation inside of your head, even though you are not moving. It could also be called dizziness, but it's not technically dizziness.
Okay, and what causes that really?
Well, vertigo is caused by inner ear dysfunction or vestibular dysfunction.
Okay.
This can be caused by things going wrong inside the inner ear.
Okay.
These are most commonly caused vertigo situations,
Okay.
but could be more serious situations such as a tumor, migraine, stroke, traumatic brain injury, such as a concussion, and also could be a tiny little hole in your ear.
And what are some different types of vestibular dysfunction?
Okay, so the simple of it, there's two different types of vestibular dysfunction. There's central vestibular dysfunction, which is caused by the brain.
Okay.
And then there's peripheral, which is caused by the inner ear or the semicircular canals.
Okay.
And the most commonly treated problem of the peripheral dysfunctions is BPPV.
Okay. And what is BPPV?
BPPV is benign paroxysmal positional vertigo.
Okay.
Benign meaning it's not life-threatening. Paroxysmal means it reoccurs and happens suddenly. Positional means movement causes it to happen.
Okay.
And vertigo is that spinning sensation.
Okay, wow.
Yeah.
And what usually causes BPPV?
So BPPV is caused by tiny little crystals or otoconia inside of your semicircular canals becoming dislodged.
Okay.
This becomes dislodged by either a blow or a strike to the head, disease of the inner ear, or actually just age-related reasons.
Okay. And how is BPPV diagnosed and treated by a physical therapist?
BPPV is diagnosed very easily and treated even easier by a physical therapist. There's a maneuver called the Dix-Hallpike maneuver, which I'm going to demonstrate, where we take a patient, we lay him down, and we see if there's nystagmus. Nystagmus is rotation or torsion of the eyeballs. This is going to be a positive test.
Okay.
Right from the test from this, we can do an Epley maneuver, where we can try to get those crystals in the semicircular canal back to where they're supposed to be and cure BPPV.
Okay. Can we see a demonstration of these two maneuvers?
Absolutely.
Okay.
So I'm here with Tom Bianco, Doctor of Physical Therapy. I'm going to demonstrate the Dix-Hallpike maneuver to test to see if there is BPPV present in him. What I'm going to do is I'm going to position the patient along sitting on the table, sitting here like this. I'm going to have them turn their head one direction to test the right side of the ear. Whatever way you turn, you're testing the opposite side. From here, I'm going to control the patient downward, off the end with their head off the table, tilt at 30 degrees, and look into their eyes. What we're looking for right now is nystagmus, or an upbeating or downbeating of the eyeballs. This would be a positive test. If we do see a positive, we can go right into the Epley maneuver, where from here, once the nystagmus has stopped, you wait 30 seconds, where symptoms have resolved, and then wait 30 seconds. Then we're going to turn the head, look for nystagmus again, or symptoms to stop, plus 30 seconds. From there, we're going to have the patient roll onto the side. We just turn their head. So you're going to roll over to your right, keeping the head down and controlled by the physical therapist. Again, we're going to ask the patient, do they have symptoms? Look into their eyes for nystagmus or beating of the eyeballs. Once symptoms have stopped, wait 30 seconds. This 30 seconds is when the crystals or otoconia are being put back into the position where they're supposed to be. From here, we're going to sit on up. You want to stand next to the patient after we sit them up because they may feel disoriented or a little dizzy, but this will resolve quickly. If the test was positive and the Epley maneuver was done correctly, most of their BPPV would have been resolved.
Thank you for demonstrating the Dix-Hallpike maneuver and the Epley maneuver. Yeah. So how long does it take BPPV to resolve itself?
Well, with those maneuvers right there, if it was done correctly and efficiently, it should be resolved at that point. But it may take from 2 to 6 visits to be resolved, just because of the dependence on the severity of how many crystals were dislodged and the length of which they were experienced BPPV.
Okay. And what is the typical reoccurrence rate for BPPV?
Now, most of the time, they're cured after this session is over or after the 6 visits.
Okay.
But within the first year, 25% of patients can have a reoccurrence.
Okay.
And within the next 5 years, about 50% of patients have a reoccurrence.
Okay.
But it can be diagnosed and treated just as efficiently and effectively as the first time we did it.
Okay. So are there any other recommendations you have for patients with BPPV?
If you're noticing that you're lying down, tilting your head, bending over is causing dizziness or a spinning sensation, you may want to consult with your physical therapist about BPPV treatment.
Okay. Well, thank you for interviewing with us today.
I really appreciate it. Thank you very much.
Mm-hmm.